Riles. I'm the Executive Director of the Northwestern Buffett Institute for Global Affairs. Welcome back to another episode of our webinar series, Confronting COVID-19. Months into the coronavirus pandemic, researchers around the world are working to understand the effects on people's attitudes and behaviors. How do people feel about isolation and lockdown? What kinds of media are we consuming? How is media shaping the choices we make and the knowledge we have and the practices of social distancing we engage in? What kinds of trade-offs are we willing to make between safety and health and economic well-being? So to discuss all of this, we have two wonderful speakers with us today who are going to share some of the preliminary findings from ongoing studies they've been conducting on precisely these questions. So first, it's a great honor to introduce my wonderful colleague, Beth Redbird. Beth is an assistant professor in the Department of Sociology at Northwestern, where she studies the impacts of group structure on inequality. She explores issues of racial inequality, group interactions, occupation and work, social class, and survey methodology. She recently decided to put her entire research agenda on hold to study COVID-19, and she's leading a large-scale nationally representative panel survey that she's going to tell us about today, along with some early results from that research and some information about next steps. Beth is joined today by Dr. Tymofii Brik, who is an assistant professor in policy research at Kyiv School of Economics, and he will discuss a comparable effort he has been engaging in the Ukraine. Tymofii is currently a Fulbright visiting fellow at the NYU Sociology Department, and his specialty is the sociology of religion, economic history, and social network analysis. Welcome, Beth and Tymofii. Really looking forward to what you have to share with us today.
Thank you, Annalise. Appreciate the kind introduction. So as Annalise mentioned, my name is Beth Redbird, and I'm a professor of sociology. And I recently decided to pivot my entire research agenda to study COVID-19. I'm not totally sure it was a good idea, but time will tell, I guess. So I'm here today to tell you a little bit about the data collection effort that we're currently in the middle of. And so what that means is this is going to be a largely data-less talk, just because we're still in field. But I thought I'd take the opportunity to give you some of our somewhat more interesting, like early findings. What happened in March is I helped found the COVID-19 Social Change Lab, which is funded by the NSF Converge Project and the National Hazard Engineering Research Infrastructure Project, and is part of the Social Science Extreme Events Research Program. And basically what we decided to do was I was sitting around watching the president's declaration of the state of emergency and thinking about all the things that I had to do to get my family in order. And life changed super fast that week. So my husband's a lawyer in Northern California, and they ended up under the nation's first shelter-in-place order. Northwestern was talking about whether or not we were going to have to pivot mid-quarter to be online, and a whole bunch of other things happened that week. And it occurred to me, if my life was moving that fast, it's entirely possible other people's lives were also moving fast. And that in social science, once things like opinion, attitude, and behavior are gone, they're often very difficult to reconstruct. And so I felt like we had a bit of a social and moral obligation to preserve as much data from this time period as possible, just to preserve it so that researchers can do a social autopsy of the COVID pandemic for years to come, which I'm sure we all want to. So as part of that, there are about 15 affiliated faculty in the lab, and what we decided to do was a big data preservation effort. So, for instance, we're running the COVID-19 Social Change Survey, which is mostly what I'll focus on today. It's, I'll tell you a little bit about what the survey is and give you some, let's go with fun descriptives out of it, and show you where you can explore the data. We're also working with a couple of GPS programs nationwide to capture social distancing metrics at very small geographic areas. We are working to capture some local policy response data since the policy response has been so patchworked. And we're also doing some cultural, visual, and storytelling data capturing. So I want to focus today a little bit on the social change survey, just because I think that's the most interesting part. Maybe that's because I'm a survey methodologist, so that might be my bias there, but I think it's the most interesting part of the lab. The social change survey is funded both by the Weinberg Dean's Office and the NSF Rapid Program. It launched on March 11th, and it's a nationally representative survey with an oversample of Americans over the age of 55. It's administered daily, and it's a panel survey, and I'll explain what those two things, how those two things consequent for what kind of conclusions we can draw out of it. And it's an internet panel. So what I mean by it's a daily survey is literally we're in the field daily. And what that means is that we're able to track trends in fast moving opinion as they occur. And it was designed this way intentionally because what happened in March was we were all sitting around saying, why is life moving so fast? And shouldn't somebody be measuring that? So we're in the field every day and we capture changes in the way people feel and think every day. So for instance, how serious a threat is COVID-19 to your health? We can look at trends about that every day. But what it also means is that we're large enough that we can do some context analysis. So for instance, here is geomark locations for our respondents. And so we're not big enough that you could say do really small area analysis, but you can do context analysis. So for instance, you could do a large event difference and difference analysis out of the data. So we might look at the impact of the first 100 deaths in an area on how serious a threat COVID-19 is to your health. And we could line up a bunch of different geographies based on that information to understand how what happens in an area impacts what happens in people's lives. We're also a panel survey. And so everybody that we started surveying in early March, we went for 6 weeks collecting respondents. And then around the end of April, the conversation in the United States started to pivot away from some of the early pandemic discussions about, for instance, is this a pandemic and is this serious, to should we reopen? And when that conversation in the United States pivoted, we also pivoted and we returned to every person that we had surveyed in prior waves and asked them to take a second wave. As this actually, we're in field for the last week of the second wave right now. And as it currently stands, we're set to pivot to a third wave soon. And then we think we'll have the funding to do a fourth wave and then a follow-up post-election wave. So what that means is we'll be able to look at how people's behavior has changed over time on specific individuals and do kind of a quasi-causal analysis of what's going on in people's lives during this time. Our topics are immense. For instance, we do health and stress, risk, uncertainty, time preference stuff. We do knowledge and information like media use, and we map people's information exchange and do trust and science stuff. We looked at household response, so preparation behaviors, social distancing behaviors, time use. We look at trust and institution response and how people feel institutions in their area have responded. We look at social and community engagement. We'll look at political participation a little bit more come the fall. We look at financial well-being and work. We're mapping job change and income response, access to food and medication, employer response. We map resource exchange networks, so who people are exchanging information and resources with. We look at public policy response, so what people think the government should and does do, some rights versus safety stuff that I think Annalise alluded to in the introduction. And we look at family and household relationships, migration, childcare, homeschooling, school response, demographics. And then just this week, we got some information that we think we're going to be able to administer an antibody test at the end of the year to every one of our survey respondents, so we can line up how behavior and attitude have impacted the likelihood that you actually get sick. So those are our survey topics. It's very large and it keeps me up at night. So let me give you a few, let's say, fun-ish results from just what we see in the field today. So the first question I get actually a lot, which I think is kind of fun, is are we ready to return to normal, or is there a new normal, and what does that look like? And so I pulled some questions that I thought were kind of fun last night. So for instance, we ask, today, how comfortable are you interacting with a stranger in your community? And the answer choices were very comfortable, a little, very uncomfortable, a little uncomfortable, somewhat comfortable, and very comfortable. And we asked across like shaking hands, passing in the hallway, walking next to somebody on the sidewalk, and sharing an elevator. And you can see that in general, we're pretty uncomfortable with strangers in our community today. 70% of us say we're very uncomfortable shaking hands with a stranger in our community. 46% of us say we're very uncomfortable with passing a stranger in a hallway. So we continue to be pretty uncomfortable. And I wasn't super surprised by this because strangers. But we actually asked the same question of a friend. How would you feel about a friend? And the pattern is very similar in a lot of ways. So for instance, almost the majority of us continue to be very uncomfortable shaking hands with a friend. We're a little more comfortable passing a friend in a hallway or on the sidewalk, but we still wouldn't want to be in an elevator with a friend, which is kind of interesting. And we also asked questions about like how long will it take until you're no longer worried about a couple of other things. So for instance, being in a crowd, and the response options are I'm not worried now. It'll be a week or two before I'm not worried, about a month, a couple of months, longer than that, or I may never be not worried about this. And you can see, for instance, that the majority of people think it's going to be longer than a couple of months or maybe never before they're not worried about being in a crowd. The same is true of a movie theater and riding on a bus and riding on a plane. So we, I think, are well aware that there's kind of a new normal coming that's going to last for a while. These are, of course, all big public spaces to exist in, and we can look at slightly more intimate spaces and see that we are still a little uncomfortable in these spaces. So for instance, about 30% of us think it's going to be more than a couple of months before we're comfortable getting a haircut. The only kind of exception to this is we seem fine handling our mail for the most part. And again, like 30% of us, 35% of us think it's going to be more than a couple of months before we're comfortable going to a hospital again. So we definitely have arrived at this kind of conclusion that as a society, this might go on for a little while. So I also get asked a lot, are Americans pulling together, and what will be the result of that kind of change in solidarity? So to give you a little bit of background on the question, for instance, a lot of you are familiar with the rally around the flag effect. It happened after, say, the 9/11 attacks for George W. Bush, where there's this huge increase in public support for leadership and then support for policy change around that. And indeed, some of you might remember the Senate authorization to use force comes out of this time period. So does the Patriot Act. So does, say, the Academic Bill of Rights comes out of this. In the United States, of course, Trump's had a very small comparative and very short, comparatively speaking, rally around the flag effect. And so the question becomes, will there be taste for kind of the same policy changes that we saw after 9/11? So will we want to say, for instance, curtailing freedoms for safety in the same way that we did then? So we have in the survey a solidarity scale, which includes about 10 items, and I just compiled them into a scale for you today. And you can see based on that, that actually since the mid-March, solidarity in the United States has declined. And I should say a word about the FIT trend line in here. It's just a time-based trend line. It doesn't contain any covariates or anything like that. It's just a time trend fit that's allowed to be curvilinear. So social solidarity has declined in the United States over time. And we ask about a whole bunch of policies and should the government do various things to restrict freedoms. And you can see, for instance, that we started out with some things that we thought were likely to happen, like the closure of businesses and the closure of schools, but we also pulled out some things that we thought were really restrictive that would likely never happen, like postponing elections or arresting Americans who refuse to stay home. And I'm sorry to say that our thoughts since early March have not necessarily aged well. But if we compare into a scale, we can see actually that during the month of April, there was a big increase in support for restricting of liberties, and that dissipated rather quickly. And we can see it across, say, for instance, forcing businesses to close or canceling large events. But we can also see it in terms of like, should the government prevent Americans from traveling within the US, or postponing elections, or arresting Americans who refuse to stay home. About the only things we don't see that trend in is, for instance, tracking the movement of Americans using GPS, which there was never much support for, and forcing Americans to get a vaccine. And because of this, we've actually included in the second wave a bunch of anti-vaxxer questions to try and get at what it means to have a vaccine and things. So we have also a patriotism scale. So what does it mean to be American and how do you feel about that? And so we can see that there's been this general kind of decline in patriotism based on that scale over the course of the pandemic in this same period of time as well. I'm going to skip these because I'm running out of time because I'm long-winded. And so the neat thing about the survey is that it allows us to track time change periods and hopefully eventually make conclusions about not just what happened during this time, but what it means. And so we're really hoping to construct out of this an understanding of exactly how people's cognitive structures functioned during the pandemic and what that meant for their behavior. And so in that respect, I've been working with Tymofii because what we're really interested in part is how information has been exchanged in the pandemic. So the pandemic wasn't just a public policy crisis. It was also a information crisis, right? It's not just a public health problem, it's a social problem in that stopping a pandemic asks people to engage in cognitively and behaviorally difficult behavior change. And so it, for instance, stopping a pandemic sometimes requires that you stay home for a period of time and that you experience a large inconvenience and a big shift in your behavior. And in order to do so, in order to encourage Americans to engage in that behavior change, the first thing that had to happen was the government had to formulate a policy response. They had to communicate that policy response. Americans had to take in that policy response, understand it, form an attitude, and then change their behavior. And that's a long stream, a lot of which involves the exchange of information. And so what Tymofii and I have been discussing in part is how do we understand information exchange comparatively across societies? So for instance, in the United States, we know a lot about media bias, and we also know a lot about, say, trust in institutions and trust in science and how religion and education play a role in that. Right. But the context of America is very unique. And I think he'll talk a little bit about the context where he's from the University of Kyiv and Ukraine and see that there are similar trends that play out, but how they impact attitude might be very different. So I want to let him have an opportunity here to discuss some of his findings. And then maybe we can talk a little bit about what the two societies mean when compared to one
another. Great. Thank you very much. Thank you, Beth, for your presentation and for this sort of segue and letting me start in my presentation. I'll be sharing my screen now with the audience. And in case of any technical problem, please let me know what's happening. So, and of course, thank you very much for this opportunity to be here in your online conference and present some of my findings. So here on the screen, you see this little creature. This is how the real Ukrainian coronavirus looks like. And I'll be talking about a very different country with a very different context. However, surprisingly, with some striking similarities, because Ukraine has been under the spotlight quite recently, and this country is quite known internationally for a few facts. For instance, that the president of Ukraine is a former businessman and celebrity who hosted popular TV shows. That quite recently in Ukraine, there were few big events related with police brutality that resulted in mass protests. And this mass protest actually changed the country and shifted the political agenda and the government of the country. And this country, Ukraine, has quite a long experience of living with Russia as a neighbor, and thus we experienced quite a lot of events when Russia tried to intervene with our elections, or maybe try to pollute the information space with bots and fake news. So even though I'm talking about Ukraine right now, still there are some similarities with the way how people perceive the United States today, and this is something that motivates me a lot to do this research, to think about our countries, how different they are, and yet that in some respects we are similar and we are similarly fragile to big crises. So it's very important to understand how different societies react to these crises, and maybe we can get some insights and learn something interesting from our experiences and our data to share with the community of scholars and policymakers, and to try to build a better understanding how to deal with these crises. I feel that I need to give you a bit more of a context about Ukraine and how Ukraine has dealt with the COVID crisis before talking about the data. So on the surface, Ukraine is not one of those countries, that actually suffered a lot comparatively to other like the United States or Brazil or Russia. So just the data I have here on the slide is from the previous week. So the data has changed slightly, but not so dramatically. Just in terms of numbers of confirmed cases, there were about 24 confirmed cases in Ukraine. Most of them are registered in the capital city of Kyiv and few Western Ukrainian regions like Tymofii, Rivne, Lviv, Ivano-Frankivsk. This is all Western Ukraine. And this was not a surprise for people who study Ukraine, because we know that these regions actually have quite a significant share of labor migration. So a lot of people from these regions, they travel to countries like Poland, Italy, Spain for labor, and then they return. So it was not a surprise that they had high risk of getting the disease. And in terms of how the government reacted to the crisis and what kind of measures it implemented, it was actually quite a quick and strong response. If you're interested, I suggest you read in the blog in English by my colleague Ivan Gomza on the website of PONARS. PONARS is the community of scholars who study post-Soviet region. And the reaction of the government was quite quick and quite strong, in a way that, just to give you an example, not only mass public events were canceled, but also public transport was shut down in Kyiv, in the capital city. For a very long time, the public transport did not function. And if you just look comparatively in the data, it seems that Ukraine, comparatively with the direct neighbors, with Poland and with Russia, looked quite okay-ish. Although, of course, there is a very big debate, and a lot of people argue that there is an issue of underestimating the cases of COVID, because we don't have a lot of testing. So testing is really lacking in Ukraine, and this is still a social and public health issue problem. But still, one can argue that other countries also have this bias. So sometimes biases cancel out each other. So things like Ukraine went comparatively quite well through this crisis. And there are I'd like to talk about some important events that possibly shaped the public perception of both the COVID crisis itself, but also of the Ukrainian government and how the government responded to the crisis. There was a quite long saga, approximately in February, which was related to those Ukrainians who lived in Wuhan in China, and the government decided to evacuate them and bring them back to Ukraine in the plane, and then transport them to the special facilities for quarantine in a small city in central Ukraine. And the local population, people who lived in this territory, they didn't like this idea that someone, possibly, the carrier of this weird disease, might come to their territory and maybe put at risk their communities. So local population actually protested against this, and the police had to intervene, and it was brutal. Some people had to be arrested, and everything was broadcasted, and it was a big event discussed on national TV, and all political leaders and pundits and social activists, they had to talk about it. So this event actually shaped how Ukrainians viewed the crisis and the response of the government. And another set of events was related to religious celebration of Easter in Ukraine. Those people who consider themselves religious, the majority of them identify with Eastern Orthodoxy, and the Orthodox Church is not monolith in Ukraine. There are different jurisdictions of the Orthodox Church, and they reacted quite differently to the crisis. When some of the churches encouraged people to stay home, other churches actually encourage people to visit the holy places, and especially during and to pray collectively to celebrate Easter. So it definitely affected how people responded to crisis depending on which religious group they belong to. And of course, it clearly affected the public debate about the role of the church and the role of the government, whether the government has to regulate religion and religious institutions or not in the face of a crisis like that. So just like Beth mentioned, she felt that she had some moral and professional obligation to study COVID and how our societies respond to COVID. I felt the same, and many other sociologists in Ukraine felt the same. Actually, there is no shortage of quick data collection exercises. Many different organizations in March and April immediately started doing their representative polls using online surveys or maybe phone surveys technologies. National companies like Ipsos or Kantar, they also have their offices in Ukraine, so they included Ukraine into their comparative blogs. My team and I, we used the technology called Gradus, which is a smartphone application. So we have a sample of people who have this application on their smartphones, and we can send our questionnaires to the smartphones and track the reaction of people. And because this technology is quite flexible and allows us to be very quick, we were actually the first company in Ukraine who started asking questions about coronavirus earlier in January. And January, well, almost February, but still it was quite quick. So to give you a few background notes about this application. So of course, since it is for people who use smartphones, the sample is restricted by smartphone users. We are talking about large urban areas in Ukraine. Our respondents were recruited from there, so we cannot talk about rural areas at this moment. The way how people were recruited, well, it was quite, it changed over time. So some people were recruited probabilistically through online surveys. Other people were contacted through promotions and online advertisement. So really differently. And population, when I say population, I mean users of this application, Gradus. It actually changed over time as well. So we had about 1,000 people. Now we have about 200 and a half. And the response rate is usually about 50–60% on all questionnaires that we send. We cannot do it on the daily basis. From time to time, we send ad hoc survey questionnaires to survey different subjects. And we run surveys regarding COVID in these days, in January, March, April, and in May, we also had some additional surveys where we were able to use some of the questions borrowed from the survey of Beth. And this is just, sort of a quick data to give you a quick understanding what was happening in Ukraine. So these questions, the top is how likely are you about to get coronavirus. So basically we ask people whether they think that it's likely that they will get the disease. And in the second question on the bottom, we ask how worried are they about getting coronavirus, because people can think that they are likely to get it, but still they not necessarily afraid of it because maybe they think that this is a regular flu or something like that. So in the beginning, in January, a lot of people didn't worry about it at all. However, in March, and even with the difference on 1 week, the rates of people who started to get worried significantly increased. And we believe that it was actually affected by these public debates and public discussions of the crisis. This is one of the slides that shows you the difference by religious groups. I also decided to share some funny responses of our panel. So here people are divided with respect to the religious group they belong to. This box is for people who belong to the Ukrainian Orthodox Church of the Moscow Patriarchate. So they have this strong attachment to the Russian Orthodox Church. And we asked them whether they believe that praying can cure coronavirus. And you can see that about 20% of people actually responded positively. They believe that praying can cure coronavirus, and some people were kind of hesitant. And this is quite different from other Orthodox groups. This Orthodox Church of Ukraine is a new independent Orthodox Church of Ukraine, and the answers of these respondents were quite different from those who belong to the Moscow Patriarchate. So, and we connected to the way how the church responded, how the religious organizations responded, because the Moscow Patriarchate actually communicated a lot with the congregations, encouraging people to attend the churches, and we see the consequences of that. People use different social media and different types of connections to learn about coronavirus and about different rumors related to coronavirus. So we asked them about a bunch of sort of fake news related to China, whether people believe that you can get coronavirus, from buying something from China, from eating bananas from China, or whether it was a biological weapon produced in China. And we see that people who and their personal ties, like friends, families, on average, they responded more positively to this fake news. So the way how people are engaged in social communication with others shapes how they understand the crisis. What also was quite interesting for me to see how the responses changed over time was this simple question whether Ukrainians fear coronavirus and for what reasons they fear the coronavirus. For instance, if you ask a respondent if they fear because of some personal health issues, the numbers are quite stable. About 40% in our panel said that they fear that. But if you ask them if they fear for others, for the health of others, significant others, then this fear kind of increased in the course of time. So Ukrainians seem to perceive this as really a public health issue rather than their personal issue. An interesting finding that I was kind of surprised to see, you see this table reflects what was happening on March 15 and then April 8. So the difference is like 3 weeks. And in the middle of March, when we asked people about their actual behavior, and we asked, did they wear masks to protect themselves? Only about 7%, and 7% is really few people said that they did. However, in 3 weeks, about 84% confirmed that they wore masks. And the reason is very simple, because the government told them to do so, because there was a very strong governmental intervention that public transport was shut down, public events were closed, the government did a very strong promotional campaign, and people reacted swiftly. And usually Ukrainians don't trust to the government and formal institutions, but not in this case. And yeah, we also collect some data about actual economic outcomes, and we asked people how did their life change regarding their occupational status, and 19% of our respondents said that they actually lost their jobs because of the coronavirus. So they connected their employment status change with the crisis. And about so 13% of respondents said that they began working remotely part-time, and sort of them started working remotely full-time. So definitely the context has changed for many of Ukrainians, and this must affect how they view the crisis. So just, to cut the long story short, I will summarize my findings. I will just tell you that Ukrainians, yeah, they worry just like everyone else. And the way how they perceive crisis changed over time from little worry to significant worrisome. However, it seems that the way Ukrainians respond to crisis actually is connected to the way how they are embedded in social relationships with formal and informal institutions, whether they trust to formal institutions or to informal, like to religious communities or the families and neighbors. This can actually dramatically increase how they view their views on the crisis. And this is so the question here, the paradox would be like, why would Ukrainians who usually don't trust the government actually comply quite a lot and wear masks? And our working hypothesis now is that the government actually motivated them using very clever messages that were packaged in a way that we care, about our communities, about others. So this social care about others kind of worked with Ukrainians. But in order to confirm this hypothesis or to test this hypothesis, more research has to be done, and we're planning on running some surveys and experiments with our respondents. We plan to confront them with different treatments, with different messages, and to see how they react to them. So I think I'm running out of time. So thank you for listening to my presentation. And yeah, I'll be happy to pass the microphone back to Beth and to talk with the audience during the Q&A session. Thank you very much.
Thank you very much, Tymofii. Maybe if you could stop sharing your slides so we can see Beth. Great. Thank you. Wonderful. Great. Thank you both very much. Extremely interesting material. Lots to talk about here. Maybe Beth, I'll start with a question for you and then one for Tymofii and then open it up. But let me just say that anyone who has questions can just post them in the chat and I will ask them. So please do post your questions as we get started here and we'll put them to Beth and Tymofii. So really interesting material. You mentioned a couple of survey questions which are of particular interest to this audience, so I just wanted to ask you about them. One was you asked people what they thought of the statement, "We are citizens of the world." And I'm just wondering if you could comment at all on what you found there. And then the other one I noticed that was really interesting was to this group was that one of the things that we should do as a policy response is to keep non-US citizens from returning to the US. So I'm just wondering if you could talk about those two or any of the other global facing questions in your survey, please.
Yeah, so you asked kind of interesting questions. I got asked a lot over the last week, of course, based on what's going on, to unpack what it means, what solidarity means in the timing of the pandemic and now in light of the police protests. And solidarity is taking kind of an interesting turn in the last couple of weeks, which I think really speaks to what it means to be in solidarity with a community. So for instance, solidarity amongst people of color in the United States was really stable over the last 3 weeks. But if you actually unpack those questions, what you see is a big increase in solidarity with people of color with their world community. So in response to those couple of questions about what it means to be citizens of the world, and an increase in solidarity with neighbors, right? And given that we know a lot about racial segregation in neighborhoods in the United States, it's perhaps not surprising to think of that likely people of color's neighbors are more likely to also be in communities of color, but that solidarity with the nation and the United States dropped significantly for people of color in the last 3 weeks. So what we can see is what's disguised as a really stable solidarity measure is moving solidarity with a bunch of different nested communities. Right. Whereas white solidarity dropped slightly in the last 3 weeks, but it dropped slightly kind of across all three of these different levels of community. And so I think that when we think about solidarity, we definitely want to understand that people are nested within communities and that those different communities mean different things. You also ask about like keeping people abroad from returning. And so we have a bunch of questions in the survey that look at othering of the pandemic. So to what extent we're blaming other nations for their bad behavior, to what extent we're accepting responsibility in part for the spread of the virus here, to what extent we blame China or the WHO, or how we feel China's response went, or even whether or not we trust Asians less. And what all of those questions kind of show us are similar to what we see in terms of an understanding of what it means to be American, is in that there was this big shift in othering of the pandemic during April, and that has sort of backed off in the last month or so. So we definitely saw a big drop in, say, trust in Asians in April, and that trust has rebounded in May. And so I guess the bad news is that while solidarity declined, we also saw this big increase in mistrust in others and blaming of others. But I guess the good news is that at least for the month of May, it seemed like it might be temporary, and that othering maybe has gone back to pre-pandemic levels.
Wow, that's super interesting and important. Thank you. Geez. Okay, great. So Tymofii, let me ask you a quick question to start things off. Also, you mentioned at the beginning of your talk the situation of lack of trust in the media in the Ukraine due to interference from various forces, nation states, non-nation states, and so on. I'm wondering if you could talk at all about, I realize this is probably outside the purview of what you do, but could you give us any insight into whether you and your colleagues are seeing any of those forces exploiting the pandemic in any particular direction? Like, how is this pandemic and people's reactions to it being represented by those on social media who are trying to destroy trust in institutions?
Yeah, well, of course, this is a very big question, and you're right, it's a bit out of my Ukraine shares. There is a sort of universal patterns that are true for Ukraine, just like they are true for the United States, that people rely on their bubbles, informational bubbles, and those channels of information that they select carefully for themselves. So Ukrainians rely quite strongly on mainstream media, TV, and lately they also began to rely on social media like Facebook, mostly Facebook. Twitter is quite marginal in Ukraine, and some alternatives like local messengers and local social media that are popular in Ukraine. And in this particular situation, in case of social media, of course, the effect of bubble is much, much stronger because you can structure your own bubble according to your views and preferences. So I don't think that I don't know whether foreign forces exploited this or not. I don't have any evidence on that, so I'm reluctant, hesitant to talk about it. But definitely there was a lot of inside political debate in Ukraine because coincidentally the crisis of COVID coincided with a series of political crises in Ukraine, including the change of the government. So the government was changed, the prime minister left, few ministers left. There was a gap when some ministries did not have leadership, so someone new had. And of course, different political actors tried to, well, use this to the benefit, and they different programs like what should we do now in order to attack the crisis. So there are a lot of different voices in Ukrainian media talking about crisis. So I don't think that there was a particular threat of sort of fake news attack or something like that. But I think the informational space was just polluted with a lot of political debates and pundits and political actors who just tried to say something meaningful to show that they can solve this crisis or something like that. So it was a lot of noise, and I think the noise was well, noise is never good. So.
Interesting. Okay, Tymofii, we have another question for you from a listener, a participant in Indonesia.
Oh, wow.
Who is very interested in your remarks about the role of religion in this issue, because obviously religiosity is very much part of Indonesian life. And they point out that even though the government in Indonesia is recommending that people not engage in worship services and so on, there are some sort of hardcore religious, the person calls them religious fanatics, religious figures who are really encouraging people to attend religious services and claiming that their religiosity is being persecuted. They wonder if you've seen anything like that in Ukraine, what comments you have about that.
Yeah. And now I have second thoughts about my previous question. So actually, this is a very good that this person from Indonesia asked this question, because now I can connect it to the previous one. So in Ukraine, the majority of religious population identifies with the Orthodox Christianity stream. And Ukrainian Orthodoxy is quite different to the neighbors, like to Russia or Romania, Ukraine or Georgia. Ukrainian Orthodoxy is not monolith. So there are different jurisdictions, different groups who compete with each other for the status of a national church, something like that, to simplify it. And the thing that one of these churches has a very long history of being connected with the Russian Orthodox Church. So of course, there is a lot of speculation now in Ukraine that the messages sent by this church and by religious groups from this particular organization possibly were somehow contaminated or influenced by Russian agenda as well. So this is one of the sort of points that people often bring up. And coincidentally, this particular group reacted critically to the government. When government encouraged people to stay at home and to take quarantine measures, these particular religious groups actually played the denialist card. They were arguing that, you know, a real Christian should not be afraid of anything. It's okay to attend masses. It is important to be careful. It is important to wear gloves and use sanitizers and wear masks. And yet it is still important to attend church, especially during Easter, because Easter is one of the central religious celebrations. And at the same time, another Orthodox church, which is the Ukrainian autocephalous independent Orthodox church, they complied with what government was saying. They actually sent quite strong message that people should stay at home and listen to online liturgies. And yeah, so there was definitely some variation. And one of religious groups, this related to Russian Orthodoxy, did not comply with the government and actually competed with the government, offering their own narratives of what people should and shouldn't do. So it was quite influential in Ukraine, yeah.
Interesting. So another question for both of you. One of our participants points out that one of the interesting comparisons we could draw between the Ukraine and the US is that both have populist governments at the moment. And they're wondering what you think about the effect of this crisis on populism, or the effect of populist government on the way people are reacting to all of this.
Oh, wow. Yeah, well, I guess I should comment as a person representing Ukraine. Well, it's a very complicated question, of course. And I feel that even though the presidents in our countries are populistic, charismatic leaders, I think there is a very strong difference in the strengths of institutions. The United States has a long history of political institutions that govern democracy in the United States, and Ukraine is a relatively young state that emerged after the collapse of Soviet Union. So the institutions are quite fragile. So the impact of populistic government and the impact of populistic president, I think, is much, much stronger and has more dangerous implications for the system. So this would be my response, that I think that Ukraine has a maybe we populist we have a weaker populist but with a stronger damage consequences. Yeah.
Yeah, I think it's a good question in that, I mean, this is critical juncture theory, right? Like, I was recently reading a paper about how the 1918 pandemic impacted voting for the Nazi Party in Germany in the 1920s and 30s, and I think it's not a coincidence that right-wing populism surges after the Great Recession, right? And that social stress eras can cause sort of this idea that all things are possible and we should completely redo the way we think it, and kind of a burn the house down style approach to institutions, because when those institutions fail us in times of big crisis, it's perhaps in human nature to say, well, why need those institutions? And so, yeah, I mean, I definitely think that at least what we see in our data about like the decline of social solidarity and the rise in mistrust and things suggests that to whatever extent this is the kind of crisis that creates those problems, that there's definitely a reason to be concerned about where we're going in terms of political participation and institutional trust in the future. And Tymofii says, I think he said, institutions in Ukraine are quite fragile. And if you'd asked me 4 years ago, I would have said that we were different in that, yeah, we had this perhaps more strongly populist government, but that our institutions were stronger, though now it's today, so I don't know that I can say that. But yeah, I think that it's an interesting question on whether or not a country that's still reeling from the social consequences of the Great Recession, how well we're going to weather another social crisis is going to be a question social scientists will have to unpack for decades.
Yeah, interesting. And maybe right on that point, Beth, we've got two questions about what you're seeing in terms of differences between urban and rural areas and whether your survey included rural areas as well as urban areas. Can you speak to that?
Yeah, I mean, we're nationally represented, so we pull from both urban and rural areas. And I mean, the answer in part, and of course, we haven't done formal analysis on any of these questions, but the answer in part seems to be, I know that a lot has been made in the popular press about the difference between Republican and Democrat in terms of, like, say, attitudes or social distancing behaviors or the like. But the difference actually seems to, if you tear apart the data, it seems to come down to sources of information and whether or not you're getting your information from the President of the United States and trust that, and to what extent you've seen the actual impact of the pandemic. So, for instance, people who get their information from the president's daily briefing or from, like, and trust him as a source are way less likely to social distance. And even Republicans that don't trust him as a source of information are way more likely to social distance. And then if you've been impacted by the pandemic personally, you're way more likely to view the pandemic as not a hoax and to engage in social distancing behaviors and to be concerned about it, right? So people who've had people in their workplace or their neighborhood who they know who've gotten sick or died, that drastically increases the probability that you worry about the pandemic and engage in certain behaviors. And so what I would expect to see going forward as the pandemic moves from kind of large urban areas into more rural and suburban parts of the country is I would expect to see attitude change shift, if what is really predictive of that attitude change shift is being personally impacted by the pandemic itself.
Interesting.
I'll just really quickly jump to the last point of my colleagues and I, we did some, so we constantly survey these issues. So we do a lot of ad hoc surveys and we ask different questions. And we ask something very similar to what Beth were talking just now about, these personal experiences. And in our models, it also plays a significant role. So we applied what is called structural equation models. And this variable is a very significant mediator in these models. Yeah.
Interesting. So another question we have is about new forms of social ties that may be emerging. And I was really fascinated by what you said, Beth, in response to the first question about people trusting their neighbors more. One of our participants is asking whether your data tells us anything at all at this point about what kinds of commitments to new forms of organizations might be emerging, or new forms of social ties that might be replacing or supplementing the state or mainstream media, what have you, as sources of trust.
Yeah, I think that's a really great question. And the answer to that is no, that we haven't done a large look at that. What we want to do with the next wave, and what kind of always our plan was to pair the survey with kind of the epidemiological curve. So to kind of have a set of questions when we were on the uphill slope of the curve and at the top of the curve and at the downhill slope of the curve that kind of said, like, how worried are you about the pandemic? Where should we go from here? And then questions on the downhill side about, like, what should the government do? Like, how should we understand our society going forward? And then, of course, it turned out that there's no such thing as an epidemiological curve in the United States. We're all under kind of different curves depending on where you are and what policies have been predominant in your area. So my sampling plan was shot to heck. But yeah, what we want to do going forward is capture kind of two components of that: emerging sources of relationship and connection and network, but also we want to kind of capture new relationship to institutions. So for instance, if you feel like there's been this big increase in distrust in kind of like standard forms of institution, if you feel that what do we understand then as new forms of institution moving forward? Are we seeing people engaged in different kinds of, for example, protest or different forms of organization? Or do we see people creating new institutions in their area? And so the question for our kind of next wave is, how do we go about measuring that? So I would encourage whoever asked that question to, like, contact me, because we haven't launched yet. Like, let's discuss what questions we should include. Particularly if you know something about this area, like, help me out. I don't know anything about every area in our survey. So contact me and let's talk about what questions should be in the next wave.
How exciting. That's great. Tymofii, do you have anything to add on that question?
Well, I just salute to the enthusiasm of Beth, and I can confirm from my own experience that that's exactly what I did. I contacted her and we started talking, and we came up with some questions together, and I borrowed some of her questionnaire. So Beth is very open and collaborative. So I also encourage our listeners to participate.
Wonderful. Well, I think that's a great note to end on. Maybe, wouldn't it be wonderful if as a result of this webinar, we ended up being able to expand the study to a bunch of other countries around the world? That would be very cool. So we have to stop now. I really want to thank Beth and Tymofii for the really important research they're doing and for taking time out of their busy schedules to share this with us. And thank you to all of you for being here today. We're going to send you a survey, and we'd appreciate you sharing your feedback with us. Beth has also offered for you to reach out, so I hope that you will do that. Please join us again next week, next Tuesday, June 16th, same time, 12 o'clock. We will be hosting the incoming Dean of the NUQ School of Communications, Dean Marwan Crady, who is currently Professor of Communications and Director of the Center for Advanced Research in Global Communications at Penn. It's a wonderful scholar, very, very interesting thought leader in this country, and he's going to lead us in a conversation about media globalization and its repercussions for coverage of COVID-19. So really a continuation of the dialogue today. So again, thank you, Beth and Tymofii, and to everyone, be well and stay healthy. Thanks, everyone. Bye.
Annalise.
Thank you all. Thank you very much. Bye-bye.